Well, we've got a very special guest today, and it's so special because Alabama needs physicians, primary care physicians. Okay, where are we getting them? Well, guess what? Blue Cross is helping us do that with scholarship program. And with me is Dr. Weaver. Dr. Weaver, thank you so much for being with us. Could you give me kind of an overview on how the scholarship's working for primary care in Alabama? And, you know, I know you have to put some dollars into this type of thing. And just tell me about it in general.
Okay, I'll be glad to. Several years ago, we here at Blue Cross put a stake in the ground by saying that we felt that the overall health of a population was best managed when a primary care physician was involved. So we created this program called Primary Care Select, and the goal of Primary Care Select was to enhance the profession of being a primary care physician and encourage patients to pick a primary care physician. And then through some value-based reward systems, we can reward the physicians for taking overall better care of the patients. Part of that was the realization that there were not enough primary care physicians in the state of Alabama.
Right.
Now, it's well known there's not enough primary care physicians probably anywhere in the country, but we feel like it's even more acute here in the state of Alabama. So we decided one of the ways to fix that problem was to actually create more primary care physicians. So we put aside $7 million into an account where we could fund a number of two-year scholarships to the medical schools. We started off in about 3 years ago now in Dothan at the Alabama College of Osteopathic Medicine,
Right.
where we decided that we would fund 30 two-year scholarships. In return for that, these students promised that they would go into our primary care field, such as internal medicine, family practice, obstetrics, or pediatrics, and then practice in a rural area for 3 years after getting out of residency. We also realized while we were looking into this that there was a shortage of psychiatry as well. So we added psychiatry as an option for these students to go into as well. That program was successful. We've had well over 14 students sign up so far for this. So we expanded it this past year to UAB. UAB is going to have 60 slots to be filled over the next 5 years.
60
slots. And then the University of South Alabama will get 20 to be filled over the next 5 years. So if you add that up, this should put about 110 extra primary care physicians into rural Alabama over the next 5 to 7 years.
Well, when you put them into rural Alabama, do they go to hospitals? Do they go to private practice? Do they hang out a shingle? I mean, how does that work?
Any of the above would work. We just ask that they get into a traditional kind of practice, that they don't go just be a hospitalist or be an ER doctor. We want them to actually open a practice and see patients, follow patients, take care of them through their lives, order the appropriate testing, recommend appropriate preventative kind of care. That's what we ask them to do.
So with you had $7 million in there to begin with, and that was for 20. So how much more?
No, that was for the total 110.
Oh, for the total 110.
Correct,
Okay.
yes.
All right. So it's 110 at 70 million, and so does that take care of all of their first 2 years of medical school?
It actually takes care of their last two.
The last
so
two.
We are targeting the last two because by that time most of them have a really good idea of what they want to do when they get out of medical school. So we didn't want to catch people early when they really didn't understand. So by their third year, they are realizing that do they want to be a surgeon, do they want to be an orthopedist, or do they want to go into primary care? So that's when we say, you know, if you agree to this program, we'll pay for your last 2 years of medical school.
And you've defined primary care with 4 different specialties. And what were those again?
Internal medicine, family practice, obstetrics, and pediatrics. And then we realized again that there was a shortage of psychiatry as well. So as we were traveling the state talking to primary care physicians, that was a need that just kept coming up. Every meeting they would talk about the need for psychiatry. So we added that to the mix as well.
Was it difficult to attract those doctors or medical students to agree to this kind of thing? Was that difficult? Because I know it cost a fortune for medical school.
So it's been fairly easy. At ACOM down in Dothan, they've had a total of 17 in the first 3 years sign up for this program. This spring at UAB, we had 10 sign up, and then at South Alabama, we've had 3 sign up. And that was with very little notice to UAB and South Alabama. We anticipate next year, once the program is better described to them and better advertised, there'll be a lot more signing up.
So, okay, so you got South Alabama, you got UAB, and you got Dothan. What about the community, surrounding community, and the other doctors in the community, and the hospitals in the community? I mean, how is the reaction?
Very positive, because the hospitals themselves, the medical schools themselves, they also realize the need for enhancing the primary care program. Plus, it provides another arrow in their quiver to recruit. So now when they're out recruiting patients, they can say, hey, we have a scholarship program available. So any of you who think you're going to go into primary care, here's a reason to come to our school versus some school out of state, because we can probably get you a scholarship.
Okay, and what does it cover? What does the scholarship cover?
It covers 2 years of tuition.
Okay.
So at South Alabama and UAB, that tuition is roughly $30,000 per year.
Right.
And at ACOM and Dothan, it is almost $50,000 a year.
All of this is just another example of how Blue Cross is taking care of, I always tell the story how well it's taken care of me over the years, but it's taking care of the communities as well. This is fantastic. Thank you so much for being with us.
We're excited to do it.
Well, we're glad you're doing it.